So you talk about spinal cord injury, and it's interesting to me because there's kind of, I'm sure there are a lot of approaches, but there's kind of two main approaches that you could use science or engineering for. You could try to reconnect or regrow the damaged area and let the body kind of heal itself, or you could try to use science and engineering to bypass the injury site and see what functions you can restore that way. I have some experience with the latter, you know, trying to figure out how the body codes things so that we could replicate it, you know, through machinery. And one of the positives of trying to do it that way is potentially it could be quick, kind of quick fixes. Like, okay, if a person can't control their urinary function, we can stimulate, we can help them to restore that. But the downside, or maybe the upside of the other approach, is that if you can actually bridge the gap, then you can restore more natural function. So I guess my question to you would be, based on what you've seen and found so far, what type of time scale would you predict before this type of regenerative approach might be practically applicable for someone that was really trying to or needed help with that type of damage?
You said before that there's two approaches. One is basically jumping from point A to point C without having to go to point B using technology. Mm-hmm. And the other approach is going to be using the natural method to allow the neurons to sprout all the way through point B to reach point C. And that's going to be more natural. Now, people have used the technology where they used chips, electronic chips, to send the signals that are received from point A to point C, and the receiving end would receive all the signals. But that is that kind of technology is really good, and people have shown that in the rat models to achieve that milestone. But the problem with that technology is that it's a huge equipment that you have to carry in your back all the time, and the other problem with that is, like, it requires invasive surgery to keep a chip inside your system, and the technology goes only to a certain extent where you're able to move your hand to reach the coffee cup. But at the end of the day, you need to have a fine motor control to grab the coffee cup, which the technology wouldn't support it. It's basically going to make you help move the larger muscles and not do finer movements like to do an art or grab a pencil or to write something. It's going to be like a robotic arm for you, going to help you aid in the movement, but the finer movements will be lost. The second approach, which is going to be harder, the natural route where you allow the axons to go through point B, is going to help you regain the fine movements that you have lost, which will be more natural, and it will be your own hand to do the task. And that's what our lab here is very much interested in, and to regain the ultimate lost movement that you have lost. Now, to do that, how clinically valid it is, how clinically it's going to be out there in the market for the patients to get it. I would say within the next 5 to 10 years, it's going to take time. It's 5 to 10 years. Mm-hmm. People might be able to regain, or at least regain some of the lost function using gene therapy that we as a lab trying to use to show it in animal models. So the next step would be to get into the the primates, and then it would be the clinical trials, and then it's going to be in the general population. But it's a time-consuming process, but it's the right way to go about to heal this devastating disease, or like the injury that's going to paralyze you for the rest of your life. Yeah.
With this kind of gene therapy approach, just in general, it's both an interesting and sometimes can be a controversial type approach with people. You know, there are lots of people that are just anti-stem cells or anti, you know, introducing any type of new virus
into the system.
Into the system.
Yeah.
So, what is your response to that?
Yeah. It ultimately comes down to the treatment options the patient would have. If ultimately the question is, yes, is there a risk of developing a tumor, or like providing you, injecting you with a bunch of virus into your system? Is that going to potentially hurt you? And then, are you ready to willing to take the risk and get the treatment, or are you ready to just stay in the wheelchair for the rest of your life and be happy with what you got? Or, you know, it ultimately depends on the patient. So if it's for me, I would go for it. You know, I would take it, you know, and then go play soccer, you know, instead of sitting and watching the other kids play. Right? So if it's going to help me, and then, you know, though there are risk effects and side effects that's going to be there for the viral treatment, I'm still going to do it because I don't want to sit in the wheelchair. But that's what I said, more clinical trials are needed for it, more studies has to be conducted before this particular treatment would lead to a clinical trial out.